Hello, my name is Roxana Carranza, and my study topic was on organochlorine compounds in the environment and endometriosis in women. So an organochlorine compound is an organochloride or a chlorocarbon, which is basically a chlorinated hydrocarbon, and it's an organic compound that contains at least one covalently bonded atom of chlorine that has an effect on the chemical behavior of the molecule. These contain carbon and chlorine and many other elements. Organochloride compounds were first produced in the 1800s without their knowledge of their insecticide properties or their harmful effects on humans. This chemical has been known to linger in the environment, in personal care products, and multiple food sources. Organochlorine compounds have been shown to be endocrine disruptors, which are chemicals that interfere with the natural hormone processes of the body. And the exposure to this chemical has been linked to endocrine disruption, which leads to endometriosis in women. So endometriosis occurs when the lining of the uterus grows on the surface of organs in the pelvic or abdominal areas and can cause excess bleeding during the menstrual cycle. It's the leading cause of infertility in women, and it also causes chronic pelvic pain, painful menstruation. It could cause constipation as well, painful intercourse, infertility, and many other symptoms such as depression. The main cause of endometriosis is not clearly known, but evidence shows that there could be a number of reasons. Endometriosis is known as an estrogen-dependent disease, which means that the disruption of these hormones from the environmental exposures could be the main cause. So the purpose of this is to explore in further detail how organochlorine compounds in our environment can contribute to endometriosis in women. So our studies for this research paper included systematic literature reviews, meta-analysis, matched cohort studies, and population-based control studies. So basically, these explored the relationship between the exposure to organochlorine chemicals and endometriosis. For the systematic literature reviews and meta-analysis, databases such as PubMed, Web of Science, NCBI, PubMed, Embase, and Scopus was used. The women in these studies were from ages 18 to 50 years old. They also used laboratory methods such as gas chromatography of the blood serum, and SAS was used to estimate the 95% confidence interval of an endometriosis diagnosis. So as far as our research, one of our main topics was neurotoxicity of organochlorine, and this included chemical insecticides that were neurotoxins, which means that they affect the central and peripheral nervous system. Impactful organochlorine is DTT, and this DTT helped with the malaria crisis in South Africa. With its continued use, there were less than 10,000 cases of malaria in 1996, but after it was banned, malaria cases had increased to 62,000 in the year 2000. Although organochlorine chemicals have been shown to have positive effects in the insecticide aspect of crops, it has also shown that the chemical has the potential to move up in food chains. It becomes concentrated inside the bodies of those who consume it, and this way it causes harms in our bodies. So this research found that DTT has a mild acute toxicity by oral route, and it's quickly absorbed and spread in all tissues. Adipose tissue has been shown to contain the highest concentrations of DTT. The studies that were conducted from 2003 to 2009 had shown a correlation between DTT exposure, breast cancer, diabetes, decreased semen quality, abortion, impaired development in childhood, abnormal hormone levels, birth mass, and pancreatic duct carcinomas. Organochlorine chemicals and endometriosis. So systematic review and meta-analysis was conducted from 2016 to 2018. Out of these 51 different studies, only 10 of these were focused on ORs for dioxins, 9 were focused on PBCs, and 5 were focused on organochlorine pesticides. They analyzed the serum to assess chemical levels in the participants and to conduct an overall analysis of chemicals levels in the blood and the disease that the participant was experiencing. This study concluded that there was a relationship between someone's exposure to organochlorine chemicals and the endometriosis symptoms they were experiencing. A meta-analysis on 30 different studies was conducted, and this was focused on endocrine disrupting chemicals that were connected to also causing endometriosis. This study also found an increased risk of endometriosis when organochlorine pesticides were at 95% confidence levels of 1.4 in the blood serum. 2 different cohort studies were conducted which were very similar. One was conducted on 84 women that were 18 to 40 years old who had a laparoscopy scheduled. 20 of these participants had mild endometriosis and 12 had moderate to severe endometriosis. This study found that women who were affected with this disease usually have a higher educational status, higher incomes than those who were not affected. They also tend to have a lower BMI in women without endometriosis. The similar cohort study number 2 was from women 18 to 44 years old who also had a laparoscopy scheduled. The study also found that women with the disease were younger, of lower status, and had a low BMI as well. The case control study was interested in looking into the cases of endometriosis that were associated with those that drink alcohol, had previously given birth, and had breastfed for less than 1 year. This study was able to suggest that the probability of having endometriosis was higher with certain levels of serum concentrations of beta-HCH and Mirix in the blood. A lot of factors were taken into consideration to assess many associations between organochlorine pesticides, the serum concentrations of beta-HCH, Mirix, smoking, drinking alcohol, their age, their educational status, and their race and ethnicity. This study was able to conclude that the exposure to beta-HCH can lead to an increased risk of endometriosis. Overall, the correlation between the development of endometriosis and exposure to organochlorine compounds in the environment. The cause of endometriosis is multifaceted, and research is often uncertain to claim a single aspect, such as organochlorine compounds. A lot of these studies that were conducted were very small studies on very small systematic literature reviews as well, and a lot of the data was clear and made correlations with organochlorine chemicals in the environment and the endometriosis symptoms that women were experiencing. But none of these studies made 100% certain that the cause of endometriosis could be organochlorine compounds. There are certain trends that were found throughout these studies, such as a low BMI, and women who do not smoke had often experienced endometriosis. And an interesting fact that was found throughout these studies is that women who do smoke had a lower chance of having endometriosis because it was an anti-estrogen from the from the cigarette smoke. So overall, there are so many different factors that have to be taken into consideration to diagnose endometriosis, and a lot of these factors were difficult to pinpoint. So more research is suggested in these areas, and more trends need to be assessed throughout the research in order for there ever to be a clear conclusion that these organochlorine compounds are causing endometriosis in women. So these are my references, and thank you very much for watching. If you have any questions, please let me know and I will answer them to the best of my ability.